Alright, my name is Giselle Arriaga, and I will be going through the slides. And for this presentation, I have picked a topic to be contraceptions. What is a contraception? A contraception is birth control. It helps with females who are sexually active to prevent them from getting pregnant. It can also help them from preventing getting any STDs or stop it from spreading. Birth control was first introduced in the middle of 20th century, and Margaret Sanger, the genius herself, who had first came up with the idea. She was born in 1879 and died in the year of 1966. In the year of 1916, when she was around 37 years old, she had opened her first birth control clinic, and it was the first out of the entire world who had came up with the idea. How many are there? There are different types of birth controls. There are about 12 different methods of them, and I will talk about the top 4 birth controls that are very common and that a lot of women use. All birth control are different. There's birth control that are non-hormonal, the ones that are hormonal, and they're placed on different place on your body. By the title of this slide, we're going to talk about condoms. Condoms can be varied by sizes and style. Just make sure to talk with a partner and see which ones are most comfortable with. Around 3000 BC, some places around the world had to use fish bladder or animals' intestines as protection, since they didn't had any way, they had to use whatever they had. The first rubber condom was invented in 1855, and if the condom is used correctly, there are about 98 effective. So 2 men had the invention of the pill, Mr. Pincus and Mr. Rock. They had came up with the invention in the year of 1950. The birth control contains 2 different types of hormones that prevent women from getting pregnant. These pills needs to be taken every day around the same time for the pill to be effective. For an example, if you decide to take the pill when you wake up, which is at 8, you need to take the pill at 8 every day for the pill to be effective. So if you take the pill at 8 and then the next day you take it at 10 and then the other day you take it at 5 in the afternoon, the pill will not be as effective. It's going to lower that chance. So if the pill is used correctly and used at the same time, the pill will be 99% effective. IUD is a device that seems like a T shape, and it is inserted into your uterus. I actually talked to a couple of friend of mine who have IUDs, and I've asked for their opinion, and they say that it's in the beginning it's like a cramp feeling when they get it. But the first IUD was invented in 1909 by a guy named Richard. He was born in Germany, and IUDs are more than 99% effective, and 1 out of 100 people wouldn't get pregnant. 1 out of 100 people would get pregnant from having the IUD, which is once a year. Implants. The implant is a small metal stick that will be inserted into a woman's upper arm. This birth control can last up to 4 years. I also have a friend of mine who got the implant on her arm, and you can actually feel where is it at. And when she first got it, she had a very big bruise on her arm. But the first implant, birth control implant, was invented in 1983, and it was removed due to the overwhelming of lawsuits upon it. And the reason why they had a lot of lawsuits against it was because of the manufacturer, and it was very difficult for it to get removed, and it was very painful and a very discomfort feeling. And these are the sites that I have used for this presentation. Thank you.